Hello and welcome to Just Therapist Things, where we talk all things therapy. My name is Jordan and I'm a licensed marriage and family therapist from sunny California. I currently work at a private practice where we focus on child anxiety reduction, and I also work for a nonprofit cancer support organization. Thanks for listening. Hello, all. Hope you are doing well. Today's episode is going to be on neuroplastic pain. Neuroplastic pain is something that I have been interested in for a while now, and what it is, it's pain that is generated by the brain. But don't be mistaken, this is absolutely real pain. There is just no structural or safety reason for the pain to be present. I did a training in pain reprocessing therapy from the Pain Psychology Center in Los Angeles. The Pain Psychology Center is amazing, and they actually developed pain reprocessing therapy, which is the main form of therapy used to treat neuroplastic pain. The founder of this center has a great podcast out called Tell Me About Your Pain and a book called The Way Out. Definitely check those out, and I will link those in the episode details. Information from this episode is based on what I have learned from my training and also through my experience with clients who have chronic pain. This information is simply informational, and you should not diagnose yourself with neuroplastic pain or treat neuroplastic pain without a professional. If you are listening to this and do have pain, it is always necessary to consult your doctor before assessing it yourself as neuroplastic. We need to make sure that the pain is not structural. So first, let's talk about how pain works. Pain can be acute and chronic, meaning severe or sudden onset versus a long-standing or long-developing condition. When you are injured, pain receptors release neurotransmitters that send messages to your brain and tell the brain that something may be wrong, so it needs to pay attention. Your brain receives, processes the information, and then decides what to do, and alerts your body of what to do. The most typical example of this is if you find your hand on a hot stove. Your brain sends a signal in the form of pain to tell you to move your hand away from the hot stove. In addition to moving your body away from pain, these body reactions can look like moving something away from your body or doing something to heal the injury. So pain is a normal sensory signal that something might be wrong and that you should do something about it. You don't become aware of pain until your brain processes it. Neuroplastic pain addresses the idea that if these processing tools become a little mixed up and generate pain where there shouldn't be, we can unlearn these ways of processing and reduce pain. Addressing emotions is a large part of treating neuroplastic pain. Big and difficult emotions such as fear, stress, anxiety initiates the fight or flight response. And a lot of you may know what that is, but it's basically the amygdala's response to a perceived danger, and it propels your body into action in order to protect yourself. So when these emotions come up, you release stress hormones such as cortisol, which causes all the body reactions, causes the body to tense up, and also causes you to run away from the bear if you need to. These feelings and all this action in your brain can also increase pain sensitivity. So if you manage emotions and change your brain's interpretation of the sensation, the pain will diminish. An example of different interpretations of the same sensation can be, for example, you have one person who loves massages and one person who does not. If you have the same masseuse, the same amount of pressure on a non-injured body, one person can interpret the massage as painful and uncomfortable, while another finds it soothing and relaxing. Or a hot bath, for example. If a bath is the exact same temperature, one person may find it relaxing and good after a long day, and another may find it just not relaxing and maybe even painful. It's all your brain's interpretation of a stimulus. So, as you can tell, it takes some convincing and buy in that neuroplastic pain is actually neuroplastic pain. So, I will go over some of the ways that you can notice if it is neuroplastic pain. The first indicator, of course, that could be a sign that pain is neuroplastic if there is a lack of a physical diagnosis. So you have gotten many opinions, seen many doctors, and no one can find a diagnosis or structural reason for the pain. This is a huge indicator that pain could be neuroplastic. And if the pain originated during a time of stress, trauma, or loss or big life change, even something positive like having a baby or getting married puts stress on the brain and it can trigger pain. And of course, if it's a more negative life change or a trauma or a loss, then that can even increase the brain's sensitivity. Something else is if the pain originated without injury. So the pain is not correlated with any physical injury. There was no accident, there was no stress on the part of the body that you can remember. The pain could definitely be a neuroplastic. Another is if the symptoms are inconsistent. So sometimes they're less, sometimes they're more, sometimes they're dull, sometimes they're sharp. Sometimes it's there when you wake up, but not all the time. So if symptoms are inconsistent, this could be a sign that maybe it is neuroplastic pain. Another indicator is if the pain symptoms spread and move. There are definitely exceptions to this, such as conditions like fibromyalgia or degenerative disorders. But if a pain is due to an injury or structural reason, it will likely be localized to a specific area. If the pain moves throughout your body, for example, sometimes it's on your neck and sometimes it's on your elbow, it is a sign that it could be neuroplastic. Another indicator is history of trauma. Having a history of trauma or predisposition to anxiety, perfectionism, or self criticism, it is likely that your brain is already on high alert. You are very aware of your body, and it's likely that your pain could be neuroplastic if these mental health challenges are something that you struggle with. And lastly, if the pain decreases when you are doing something enjoyable and increases when you are doing something not enjoyable. For example, when you went on that vacation to Hawaii, your pain was not there at all. And then right when you got back to work, it came back. So, how do we treat neuroplastic pain? Well, first, the person definitely needs to buy into the fact that their pain could be neuroplastic. They don't need to completely believe that their pain is neuroplastic, but they need to somewhat maybe believe that it could be. So definitely buy in first. And then psychoeducation to understand how pain works and that pain is the brain's interpretation of a stimulus. That kind of goes in with buy in. You can use psychoeducation to educate the person on why you think the pain is probably neuroplastic. And next are relaxation techniques. So, as I said, a person with neuroplastic pain is likely probably has other challenges such as anxiety, perfectionism, history of trauma. So, relaxation techniques are essential to learn how to calm the mind and the body. This can be anything from meditation to essential oils to exercise, anything that can bring some form of relaxation. And then pain reprocessing therapy is, of course, essential to directly treat neuroplastic pain. Pain reprocessing therapy includes all of what I just mentioned, as well as something called somatic tracking, which is a big part of this therapy. Somatic tracking is reappraising the pain signals as safe and bringing awareness to physical sensations to help your primitive brain feel safe. So basically, you are going to notice the sensation of pain when you are in a more positive state of mind. And then cognitive behavioral therapy is also really helpful to address cognitive distortions, talk about thoughts, feelings, and behaviors in order to directly address the anxiety, perfectionism, and challenges like that that correlate with the pain. As I said at the beginning, please do not use this episode to diagnose or treat neuroplastic pain on your own. First, get checked by a medical professional, and if everything comes out normal, look into pain reprocessing therapy and maybe find a therapist who specializes in it. This episode is simply informational, and I hope this discussion on neuroplastic pain landed with some of you and helped you to think of pain in a different way. Thank you for listening to Just Therapist Things, where we talk all things therapy. I'll talk to you soon.